I want you to look in the mirror, and I'm going to make marks on your face to guide me during the surgery.
Deborah Saylor is about to go under the knife, but she won't be going under general anesthesia. Her plastic surgeon, Dr. Zachary Garrett, will perform a facelift painlessly under local anesthesia.
And it's a full facelift. It's not a thread lift, it's not a feather lift, it's not a lifestyle lift, it's not a mini anything.
Because there's no general anesthesia, Deborah won't have to deal with the side effects.
They don't have to go through the hangover of anesthesia, the nausea, the vomiting, perhaps the fluctuations in blood pressure that contribute to the swelling and the bruising.
Less swelling and bruising means a shorter recovery time. Corinne Murelli didn't feel a thing. Her recovery was just 3 days.
The recovery was the most amazing part of the whole procedure, because I left my office on Wednesday about noontime, and I was back in my office on Friday about 1 p.m.
Before surgery, local anesthesia is infiltrated very slowly into the tissues of the face, puffing it up to extreme proportions.
You saw yourself. What do you think?
I think I look like Fat Albert.
Dr. Garrett says that swelling is temporary, does not delay healing, and is not dangerous to the patient.
Most people look quite unusual for the first 24 hours. The amount of Novocaine we use is much, much less than what's used for the average case of liposuction. So a Novocaine overdose is virtually impossible.
I had these veins in my neck sticking out, kind of jowly, and my face was sagging here and there.
For 54-year-old Madera Caniff, the temporary fat face was worth it. She had her surgery 2.5 months ago and looked great in 3 days.
The option of being put under or being awake was wonderful.
Experience is essential for success with this procedure for 2 reasons. First, the surgeon has to be comfortable dealing with swollen tissues, in this case full of Novocaine in the face. And second, speed is critical. Dr. Garrett will do this entire facelift in about 2.5 hours. Some surgeons take up to 6 hours.
People thought I looked refreshed, like I'd gone on vacation.
A 3-day vacation that made her look 10 years younger. Dr. Steve Salvatore, Fox 5 News.
Dr. Garrett says general anesthesia is available to patients if they want it at any time during the procedure. So far, of the more than 100 patients he's treated, he says none have asked for it.